So in this tutorial, we're going to visualize the pathophysiology of venous disorder. So for the pathophysiology, you need to know that where it all starts with a venous stagnation. Is it clear? When you have a venous stagnation because either of a primary cause or a secondary cause, what happens is that the next thing that happens is that we are going to have an increased venous pressure. Is it clear? And that increase in venous pressure is called venous hypertension. Is it clear? Venous hypertension is the first usually the first complication is going to occur from the venous stagnation. After the venous stagnation, you're going to have a post-thrombotic syndrome. Basically, you're going to have a post-thrombotic syndrome. And now there are elements of the post-thrombotic syndrome. The first element of the post-thrombotic syndrome is going to be hemosiderosis. Is it clear? Hemosiderosis occurs because the red blood cells cannot backflow into the systemic circulation because they are accumulated at the level of the veins. Is it clear? So it means that the red blood cells are going to be broken down there. Is it clear? And their iron is going to be deposited at the level of the skin of that level. Is it clear? That's why you are going to have you start having hyper pigmentation at the level of the lower limbs, at the level of the foot. Is it clear? That hyperpigmentation actually is a hemosiderosis. You have hyperpigmentation of the foot in these cases because of the hemosiderosis. Are you understanding? When there's accumulation of the red blood cells, they are going to be broken down because the life cycle of the red blood cell is 120 days. It accumulates, accumulate, and then it breaks down. The iron accumulates also there, and the result to see the skin pigmentation at the depigmentation at that level. After the hemosiderosis, another thing that is going to result in a venous hypertension is also going to be the next one, which is a unilateral leg swelling. Leg swelling. So when you have a unilateral leg swelling, it can also be another sign of the post-thrombotic syndrome. Is it clear? So yeah, that's another sign of the post-thrombotic syndrome, unilateral leg swelling. Is it clear? And hemosiderosis. Peculiarly, those are the two major signs. Now, after the post-thrombotic syndrome, this is the first complication, this is the second complication. The third complication now, after the post-thrombotic syndrome, you have lipodermatosclerosis. Lipodermatosclerosis. In lipodermatosclerosis, it's going to produce plaque. You have hyperpigmented. Here it is still a form of hemosiderosis, but it is highly increased. Is it involving the sclerosis of the lipid and the dermis? Is it clear? So here you are going to have hyperpigmented plaques. Is it clear? You have hyperpigmented plaques. Is it clear? And even patches. So generally it's hyperpigmented place located at the level of the medial side of the foot. Is it clear? Now the question you're going to ask me is, why is it that it is more on the medial side when you have pathologies of the veins? Is more on the medial side than the lateral side? It is more on the medial side because the greater saphenous vein, as from the name, is greater than the lesser saphenous vein, as from the name. So the greater saphenous vein has a huger caliper. So if there's any pathology of the veins, it is much more going to affect the greater saphenous veins on the superficial circulation than the lesser saphenous veins, which has a smaller caliper. So that's why the medial side is going to be more affected than the lateral side. So you are going to have a medial on the hyperpigmentation plaque on the medial side of the foot. After the third complication, the fourth complication now is venous ulcer. Is it clear? So that's when now you have a venous ulcer at the end. Is it clear? And now later on, after the venous ulcer, you can have superinfection, local complication of the ulcer, which is superinfection of the ulcer. You have systemic spread of the ulcer, and then you have systemic complication of the. You have also local complication, which can end up to amputation. Is it clear? So those are the different things that you have to put in mind when you are working with venous obstruction, venous disorders. So after working with the pathophysiology, we are now going to move on to the clinical presentation of all what I've just explained.